From Eyewitness News, Connecticut's most watched local political program, this is Face the State.
Good morning, everyone, and thanks for joining us. I'm Dennis House. We heard the governor say in our special edition of Face the State on Thursday, Connecticut is getting ahead of the coronavirus and flattening the curve. So what does that exactly mean? With us now, the president and CEO of Hartford Healthcare, Jeffrey Flaks. And Jeff, good to see you back here with us again.
Good morning, Dennis.
So what does it mean that we are actually flattening the curve?
So we're starting to see, first of all, the answer to the question is it's regional in nature. So when we talk about flattening the curve, you're describing it globally across Connecticut, but there are still regions and subregions within Connecticut who are seeing increases day over day. But in totality, the very important and good news when we look at Connecticut as a whole is the increase day over day is starting to get closer to being flat, and ultimately we're looking for a decline.
We're about a month into this in our state. Is it worse than you thought it would be or better?
It's a hard question to answer. I mean, some of the things we've seen on the front lines are things that were unimaginable. So our hearts go out to every person who's been impacted by this, and it's been very difficult, and under all ways. At the same point, though, Dennis, I would point out we're seeing a sense of community, a sense of togetherness, a sense of unbelievable discretionary effort that's been incredibly rewarding and inspiring, and I'm in awe of people working on the front lines of healthcare. So it's unquestionably a very challenging set of circumstances, but we across the state, people are rising.
I want to ask you about two experimental drugs that are being used to treat COVID, and one is remdesivir, the other is hydroxychloroquine. I hope I pronounced that correctly. My late colleague Denise DeCenzo was amazing at these medical terms. And but how are they working, and are they being used at Hartford Hospital?
On both accounts, they're being used. In some instances, it's early in the investigation period. In some instances, we have more experience. So there's innovations occurring. There's all types of pharmaceuticals that are being introduced into the process. There's now, as you know, plasma donations being made from people who are recovering from COVID-19. So there's a lot of advances in care. They're all being studied very carefully. We're working with the Mayo Clinic, in fact, on some of these studies to make sure that we're learning as we do it, and that we're doing it safely as we care for people.
Yeah, I understand. Of course, safety is the top priority, but hydroxychloroquine can be dangerous for some people, but helpful to others. What are you experiencing at Hartford?
Yeah, so our people are using it very carefully in very select instances, and they've been using it less frequently, in fact, as this process has gone forward.
Tell us about the survival rate, because one of our viewers was asking, how come we never hear about the survivors? I realize HIPAA laws, you can't announce when a person is over this and getting out of the hospital, but there's got to be a bit of joy among your staff when this does happen.
Oh my gosh, absolutely. First of all, we've had over 300 people who were admitted patients that we've cared for. They were hospitalized, and they've been able to successfully transfer to home. And when that transition occurs, there's great celebration, and it means a great deal to our staff. Thankfully, more than 80% of the people who are being admitted into hospitals are being successfully cared for. So there's many great successes, and at the same time, our hearts go out to when there is mortality in this circumstance.
Well, our hearts go out to all of your colleagues there at Hartford Healthcare and all the healthcare workers across our state. They're doing some great work in the front lines. Jeff Flaks, CEO, President of Hartford Healthcare, we thank you for joining us again today.